If you'd like to introduce yourselves and to start your presentation, Nana and Akish.
Okay, hi, I'm Nana, and I'm an engagement lead at the UK COVID-19 inquiry, part of the engagement team. And okay, Akash will also introduce himself.
Thanks. I'm also an engagement lead along with Nana at the inquiry. I will go ahead and share the presentation now.
Just to say that it's really good of you to come this morning to talk to us and to share your presentation with us.
Thank you, not at all. Thank you for having us. So hopefully you'll find this interesting. I'll let Nana kick us off then. As we said, we're from the COVID inquiry. We're going to be talking about an initiative called Every Story Matters. Actually, I started from the last slide. That wasn't very helpful. Okay, go ahead, Nana.
Thanks, Akash, and thank you also for having us. It's great to be here. So just to start off talking a little bit about the UK COVID-19 inquiry. The UK COVID-19 inquiry exists to examine the UK's readiness and response to the pandemic, and also to learn lessons for the future. And our chair, Baroness Hallett, has structured the inquiry into modules that cover a wide spectrum of areas that include healthcare, education, care homes, and others as well. And you can find the full breakdown of the modules on our website. So we'll drop the link to that in our chat. And there are two main ways that we gather information. One is through hearings. So that's like a court process where people can give evidence at hearings. And the second way we gather evidence is through our Every Story Matters campaign. So hearings and that allow the inquiry to hear from people individually and in public, and people give evidence, a bit like in a courtroom. You might have seen some footage, some TV footage or YouTube footage of ministers or scientists giving evidence in the past few weeks. We've had some high-profile witnesses give evidence, as well as Unison representatives, and all of our hearings are streamed live, so you can follow along. You can also sign up to our newsletter to keep up to date with the inquiry's progress and investigations, and crucially, the recommendations. And also, you can follow the progress of Every Story Matters by signing up to our newsletter. So I'll encourage you to do that. We'll drop the link in the chat as well. And we'll talk more about the Every Story Matters initiative in a moment. But the next slide, just want to highlight, is Module 10. As I mentioned, the inquiry is structured into modules or topics, and Module 10 might be of interest to you on this call because it covers a range of issues such as adult mental health and well-being, bereavement and bereavement supports during a pandemic. Key workers are also covered, for example, teachers, police, funeral directors, etc. And also vulnerable people, including those who faced homelessness, domestic abuse, and more. The impacts of the pandemic onto these different groups are included in the scope of Module 10. And I can drop a link to a bit more information about Module 10 as well. So just to move on to Every Story Matters. What is Every Story Matters? So this is the UK COVID-19 inquiry's listening exercise, and it's your route to be able to share your experiences about the pandemic directly with the inquiry so that we can better understand the impact of the inquiry. So Every Story Matters provides an opportunity for those affected by the pandemic to share their experience without having to come to the hearing centre to give evidence or attend a public hearing. Every Story Matters supports the UK COVID-19 inquiry's investigations and helps our chair of the inquiry to make recommendations for the future. And let's just speak a bit more about Every Story Matters on the next slide, because we want to make it as easy and accessible for people to be able to contribute to the inquiry. And Every Story Matters is your vehicle to be able to tell us what happened to you, and the people that you are working with, or people in your personal life, like children.
You've gone.
We've lost Nana there. I'll pick up in that case. As Nana was saying, Every Story Matters is your opportunity to tell us about what happened to you, and those who were around you. So that might have been children you were looking after, other family members, friends, etc. as well. It's open to everyone aged 18 or over currently. So that can include those who were under 18 during this at the start of the pandemic, and whichever way you choose to participate, all experiences are recorded anonymously, so you don't need to worry about any negative comeback from anything you might say about blowing the whistle about bad practices at the workplace, etc. The purpose of it is to understand the human impact of the pandemic, and so we're relying on you to tell us about what happened to you and those you represent to provide that valuable insight. We know that the pandemic affected every single person in the UK, and in many cases continues to have a lasting impact on lives. And every kind of experience matters, no matter how big or small it seems. And you don't need to have actually had COVID-19 to share your story. It's important that we're looking at the impact of the pandemic as a whole, not specifically the coronavirus itself. Nana, are you back with us now?
Yeah, thanks, Akash. So sorry about that. I'm not sure why that happened. It's disconnected. But
I'll move us on to the next slide then, in that case, because I just picked up in your absence.
Oh, thank you so much. So, right. Okay. So, again, I apologize for that. Yes. So, every experience that's shared with the inquiry through Every Story Matters will be collated and analyzed and turned into themed reports, which are known as records. And the Every Story Matters records will be submitted into each of the relevant investigations as evidence. So last month, it was last month, we published our very first Every Story Matters record for Module 3. And that brings together people's healthcare experiences. And the record details the experiences of healthcare professionals and patients across primary care and hospital, and also emergency and urgent care, end of life care, maternity care. It covers shielding, long COVID as well, and the impact on clinically vulnerable families, just to mention a few. So Akash is going to speak a bit about taking part in Every Story Matters, but thank you for listening to that section.
Thanks, everyone. So in terms of the logistics of how to take part, we realised early on that most people wanted to share their experience with us in writing and online, so we designed an easy-to-use web form to share your experience. And we will share, believe Nana is going to do send an email around with all the various links, so don't worry about recording everything down. The web form asks 3 key questions or prompts for you to guide you as you share your experience. The first being to tell us about your experience, and that's the only mandatory question. So that's your opportunity to tell us in as many or as few words as you like what happened. The next 2 are optional questions, but they help us to understand a bit more about your experience. So we do encourage everybody who is able to complete those. The first being to tell us about the effect that had on you, or had or continues to have on you and those around you. And so that's the opportunity to tell us about others' experiences. So that could, in many cases, with parents want to tell us about the impact on their children, for instance. And we also ask about what lessons you would like to see learned for the future, as that's really deferring to you as the experts, given you have that lived experience. and we really want to understand what lessons you think can be learned. And our chair, Baroness Hallett, is particularly interested in this question because, of course, that will help her as she's drafting her recommendations following each module. As we said earlier, the form is anonymous, and any details that could identify you, including names, places, and organisations, will be removed at the first stage before it goes further up the process. You don't need to fill it out in one sitting, so there's a save and come back feature. So we understand, of course, completing the form is likely to be difficult, and it does take an emotional toll on many people. So we've got this feature that allows you to start filling it out, and then if you wanted to save your progress and come back to it in a few hours or even at a later date, you're able to do that. And as I said, the form is on our website, and we'll share relevant links after the call. We do know that the web form, although that is the most popular way of sharing your experience, it doesn't work for everyone. For that reason, we've got a number of other options, including paper forms that I'm a big fan of sharing with pen and paper, to us. It helps me to flow my thoughts to flow more easily. I don't know about everybody else, so we do have that option as well. We have easy read online and offline forms as well, so they're hard copy and also an easy read form on the website. We've got information about Every Matters in Braille and British Sign Language, and also 12 different languages, so that's 11 plus English. And the web form is available in all of those languages, because we understand that many of the most impacted groups but may not necessarily be confident sharing their experience in English, so we don't want that to be a barrier. In response to feedback from organisations, we're also holding Every Stream Matters events in towns and cities across the UK, and we're coming to a few more locations in the new year, which we'll speak about in a moment, the first being Manchester. These are a mixture of large open public sessions that everyone can attend, as well as smaller, more specific events for groups that are particularly relevant to certain investigations or most impacted, such as the call we're on today. So we do a mixture of virtual and in-person events, and all of these are attended by inquiry staff. We do actively monitor who we are and aren't reaching, and then we use targeted interviews to ensure that we are reaching those who we need to hear from for each module, and responding to what lawyers request. So our objective is really to be as comprehensive as possible in terms of who we're listening to. And all methods, whether you participate in Every Stone Matters via the web form, an event at a paper form, etc., they all run alongside and feed into our modules. So although you might think, oh, I wanted to share an experience about healthcare, but that investigation is now passed, don't worry, you can still tell us about that, and it still feeds into final recommendations. So I'd really encourage you to tell us, whatever you feel comfortable sharing. I did touch on this earlier, but to provide a bit more information, that we know that sharing your story can be difficult, and we want to do all that we can to minimise the risk of re-traumatisation. So that's ensure that people feel safe and supported when recalling their pandemic experiences. Across the inquiry, to ensure that we are incorporating, bearing that in mind whatever work we're doing, we've adopted what we call a trauma-informed approach. So that means that we behave and work in ways that acknowledge that trauma can affect people in different ways, and recognising the signs, symptoms and widespread impacts of trauma to prevent that risk of re-traumatisation. And the form has been designed in collaboration with those most impacted by the pandemic to take account of their trauma. And as I said, there is that save and come back feature to remove that element of time pressure when you're completing it. But in the event that you did feel that you needed additional support, we've got we do have a comprehensive support offer, including counsellors at the Hearing Centre and all public events, counselling sessions being offered to interviews before and after the interview. And also everybody who participates in Every Story Matters online can self-refer for a counselling session should they wish to do so. And Nana will include the link to information about that in her follow-up information as well. We do also refer to the full list of support organisations through the website that can offer specialised support around grief, mental health, financial support, etc. So I mentioned events earlier. We're coming to Manchester in February. We have visited the northwest region of the UK for events in the past, such as Liverpool and a little further afield in Bradford. But this will be our first public event held in Manchester. At this event and all of our events, you'll have the opportunity to drop in and speak to inquiry staff about Every Story Matters, receive assistance in completing the online form, collected paper form and printed information about Every Story Matters, and you may wish to do that to distribute to colleagues and other people who you're linked to via your networks. For these events, we'll be running listening hubs, so those are spaces where you'll be able to learn about Every Story Matters, and pods, which are quiet spaces where you can complete the form with or without assistance. We also have interactive themed discussion boards where you have the opportunity to share your experiences on a specific element of the pandemic and at the same time see what other people have shared. And those are really useful for us to understand, how the impact of the pandemic might vary by different locations. So we can present the boards to our legal teams and say that this is what people in Manchester have told us and this is what people in London or other locations have told us. That can really help us to understand disproportionate regional impacts. Thanks so much for listening. I'm coming to the end now. I just wanted to let you know that we have a partner toolkit. So if you did want to spread the word about Every Story Matters, it's got links to assets that you can download and share on social media, or perhaps print out and put up at your workplaces. And it's really important that we hear from as many people as possible. So do share your experience and encourage others to do so too. And thanks very much. That brings us to the end of the presentation, Anna, and I would be very happy to take any questions if you do have them.
Thank you so much. That was really interesting. And, we've been discussing public inquiry and how we engage with it and, encouraging people to engage with it for a number of months, well, probably years now, isn't it? I think. So it's really interesting to hear that. And it's good to see that you're so proactive now, really, in taking those issues back into the communities, because certainly one of the things that was of concern to us early on was about how you're going to hear the stories of ordinary people, and especially when the themes of the public inquiry are so specific, and it's all legalistic, and it's, it seems so far from the impact on ordinary people. And I know they're representatives, and all that. So it's really good to hear that. So anybody got any questions that you want to ask? Yeah, Jen.
Thank you. Yeah, it was a great presentation. Thank you for that. Are you going to share your slides with us as well? I know you mentioned I was going to send us some information afterwards, some links in. It would just be useful if we could have that, if that's okay.
Yeah, I'm happy to circulate those. Yes, and just to check, who would be the best person to share the links and all that? I can check with my colleague Becky.
Yes. You can send them to Jen, and she'll share them with me, and I'll send them out to the circulation.
Cool. Yeah, happy to do that.
I just had another quick question. I know you mentioned that the feedback was for people 18 and over. I think you said, I just wanted to clarify it, if there was, say, I don't know, a school leaver who was 16 at the time but is now, 4 years later, however old, did you say they could give evidence now they're over 18?
Absolutely, yeah. And we'd encourage them to do so because we particularly want to hear from the 18 to 25 demographic. So yes.
Great, thank you.
Just a quick question. Have you got a venue sorted out for Manchester yet, or are you still planning?
I believe, correct me if I'm wrong, Dada, but I believe that that is in the final stages of organisation, but we are will publicise that on our website and in the newsletter. So if you subscribe to our newsletter, you'll get the updates through that. But Nana can include a link to the events page on our website where we will share all that information shortly.
Yeah, that's it.
Just one quick one. Sorry, the delegation to London. If we wanted to take a delegation, we do want to take a delegation of some of our families to the inquiry in London, go to the COVID wall and meet up with some other people there. And we'd be interested to know if there's a particular date that you feel would be the best date for families to do that.
I am not completely sure if there's a specific date. Would you be wanting to come to the hearing centre and attend the hearings? Would that be the part of
If
the?
possible.
If we could, that would be
Yeah.
fantastic. But
Okay, we can share some information about the process for booking seats. So we have a reservation system for attending our hearings because we do have limited public seating capacity. But we can share some information about attending our hearings in person. We do share the hearing timetables for our investigations a week in advance of the hearing, so you can see who is coming in a particular week. When our public hearings are ongoing. So we've currently got Module 3, which is about healthcare ongoing, and in January we'll be kicking off with our Module 4 investigation about vaccines. So if there was particular evidence that you wanted to hear, that you've got that week's notice, and we release the booking form around that time as well. But we'll set out the process in our email.
It's quite difficult for us that only to have a week's notice, isn't it? To organise the families to come down.
Oh yes, yeah,
yeah.
I understand. Yeah, it's
Just like a
but
time, if you don't have a longer time, longer lead time that we could use.
For sharing information about the hearings, I think that would be a bit difficult. But if there was a particular module that we do have the so we have the broad hearing dates that I can share some information about those, so you'll know which module is being heard at a specific time, and that all of those dates have now been communicated publicly, so we can share those. We wouldn't be able to share that which witness is appearing when, but we can give that broad overview certainly.
Yeah. Okay. Very good.
Thank you. All right. Okay. It's really interesting. Thank you. Okay. Let me try and get these in order so I don't mix myself up. Do you know the stories? Are they allowed to be collective stories, or are they really designed to be individual stories?
So every story matters is for individual stories, but as said, that we do have the opportunity to tell us about people around you. So that might be family members, friends, colleagues, etc. So you can tell us about your view of how it has affected people around you. If you wanted to share a collective story, perhaps at an organisational level, I'd encourage you to email us. So if you go on the COVID Inquiry website, and this is another link we could include where we send round the notes, that we've got contact details on our website. So there's an email address there. And what some organisations and people who want to share collective information have done is just email that to us. And that's the route we ask you to do that for, maybe because it's every story matters being anonymous. It means we can't follow up if we did want to do that. So that's why it's not as formalised an approach, but but you're very welcome to share information via that route instead if you want.
All right, and it would still be counted for your overall collated record. Yes.
Yeah, it would. It would be noted for the attention of our legal team, certainly.
Okay, so those collated that collated information is, how's that been presented to the?
So all of the information is noted by our correspondence team, and it goes. They file it for the attention of legal teams. So we have specific research and legal teams whose job it is to go through all of that information. Should it be, I can't guarantee, because I can't speak for the legal teams, that everything shared would actually be carried through to the investigation, but a decision would be made. If this is something that they think is really important and needs to be followed upon, they would get back in touch with you. And the information that would be sent directly through to the legal teams. It wouldn't go through the Every Matters route, but it would still be counted.
Right. Right. So, I can see that you've said that you've completed, you submitted your first collated record on healthcare. I think that's what you said, didn't you? So, how many stories contributed to that?
Oh, sorry. Yeah, I just dropped for a moment.
Sorry, it's not an exact number. I'm just curious of like how many stories
So the over 30,000 stories informed the healthcare record.
Okay.
And I believe as of this week we have actually crossed the 50,000 mark. So that's across all all topics, but we did have over 30,000 specifically about healthcare.
Right. Okay, one more. Right. I've just, because when you were mentioning that you've done your first collated record, I've just gone on your website to have a look at it, and I can see that you've summarised some aspects of it, haven't you? And obviously it's because you were saying there's 3 aspects. There's the experience, the effect, and the lessons. So does the record from the Every Story Matters, that collates people's potential proposals for lessons? Or does the legal department determine the lessons that go in the record?
So, we've got the inquiry has 2 main published outputs for each module. One being the records, the Every Story Matters records, and the other being our reports that follow each module. Those are written by Baroness Hallett, and those will include her findings and recommendations. The records are literally just that, so they are a record of people's experiences. They may include people's opinions on what could have been done better, but it's important to note that distinction, that they're not necessarily views that will be endorsed or actually put forward by the inquiry as recommendations. That is the role of the reports. Is that clear?
Yeah, no, that's really helpful. I was just trying to get an idea of your process. That's really helpful. Thank you.
Okay. Anything else anybody wants to ask? No? Okay, that was really interesting. Thank you so much for joining us and for sharing that information with us. And I'm sure we will be in touch. You can see we've got we've had lots of discussions around some of these issues, lots of concerns, and obviously the work that Jen's done with bereaved families. So we have a lot of information around the bereaved families and what they've took around the workplaces that these the officers here represent, people in work, and also the continuing thing around long COVID and and how that's impacting workers. So yeah, we will discuss it